Most people think stroke happens suddenly, like lightning. But stroke is usually the final stage of a long and silent process, inside the blood vessels of the brain. Long before symptoms appear, microdamage accumulates. Oxidative stress increases, vessel walls stiffen, sodium and fluid imbalance. Push blood pressure up and circulation inside tiny brain vessels slows. Over years, this silent deterioration raises the risk of ischemic events, vascular dementia, and cognitive decline. Before the major event, many experience subtle warning signs, numbness, face drooping for a moment, difficulty articulating words, sudden clumsiness or mild memory lapses. Even if those early signs disappear quickly, they should not be dismissed. The brain is the most blood-dependent organ in the body, and its health is directly tied to the state of cerebral vessels. The interesting question is not what cures stroke, but what supports the vascular environment that prevents stroke from developing in the first place. Pharmaceuticals and surgical interventions are essential once disease arrives, but the everyday terrain in which disease takes root is shaped by metabolic stress, diet, circulation, pressure, oxidation, and inflammation. Among the many dietary factors that influence vascular health, one surprisingly relevant food is sweet potato. It is neither exotic nor expensive, yet its biochemical profile has been studied in the context of hypertension, oxidative stress, metabolic syndrome, and vessel integrity. Sweet potato contains polyphenols such as chlorogenic acid, flavonoids, beta-carotene precursors, vitamin C, potassium, and dietary fiber. These compounds interact with mechanisms linked to vascular stiffness, blood pressure, sodium retention, and microcirculatory aging. Oxidative stress is one pathway through which vessels age. Free radicals damage endothelial cells, interfering with nitric oxide, signaling and elasticity. Polyphenols found in sweet potato, especially chlorogenic acid, have been examined for their antioxidant influence in vascular biology. While dietary antioxidants are not stroke cures, they influence the pace at which vessels deteriorate. Vascular aging is not only about cholesterol, it is about oxidative pressure, glycation, inflammation, and metabolic rigidity. In population studies, antioxidant-rich diets correlate with lower vascular incident rates, especially in older adults and individuals with metabolic instability. Another relevant mechanism is the sodium-potassium balance. Excess sodium raises blood pressure by increasing fluid volume and vascular resistance. Potassium promotes urinary sodium excretion, improves blood pressure regulation, and reduces mechanical stress on vessel walls. Sweet potato contains meaningful potassium levels, and potassium intake is repeatedly associated with lower stroke risk in epidemiological research. This mechanism is standard physiology rather than alternative medicine. Fiber is another factor. While sweet potato contains carbohydrates, its fiber content delays glucose absorption. Slower absorption reduces glycation stress, which contributes to vascular rigidity and cognitive aging. Brain blood vessels are highly sensitive to glycation and oxidative stress, which is why metabolic syndrome increases the risk of vascular dementia. Preparation method significantly changes sweet potato's functional value. Polyphenols, especially chlorogenic acid, are concentrated near the peel and decrease with heat. Raw consumption preserves antioxidants, but requires digestive tolerance and chewing efficiency. Cooking increases digestibility but reduces antioxidant concentration. Individuals must choose between antioxidant preservation and digestive comfort. Many peel sweet potato out of habit, but in terms of vascular benefit, peeling removes much of the relevant compounds. In traditional food contexts, peel consumption was normal. From a modern nutritional standpoint, the peel is more valuable than the flesh for antioxidant purposes. A simple application is raw. Sweet potato cut into small cubes and eaten with mild acidity. Vinegar contributes acetic acid, which supports insulin sensitivity and modulates post-meal glucose spikes. In some combinations, citrus peel syrup introduces flavonoids such as hesperidin, known for microvascular effects. This combination is not a dessert. It is a functional preparation that balances raw fiber, potassium, polyphenols, and mild acidic influence. Another method involves fermentation. Thin slices of raw sweet potato placed in a glass container, covered with vinegar, and fed with minimal prebiotic sweetener such as oligosaccharide, undergo fermentation over time. After filtration, the resulting vinegar can be diluted and consumed. Fermentation preserves polyphenols, reduces sugar load, introduces acidity, and improves the stability of vitamin C. Small daily quantities, roughly 50 to 60 milliliters diluted, are sufficient. Excessive consumption, however, may irritate the stomach. Sweet potato-based vinegar can also be used in cooking, instead of salt-heavy condiments. Reducing sodium intake while enhancing flavor helps blood pressure management, which directly affects cerebral vessels. Dietary strategies targeting vascular health are not about discovering miracles. They are about changing the everyday environment in which blood vessels operate. Chronic high sodium intake increases vessel stiffness and raises stroke risk. Low potassium intake amplifies this effect. Oxidative stress accelerates vessel aging. Glycation stiffens microvessels in the brain. Inflammatory pathways affect endothelial flexibility. All of these processes operate silently for years. Sweet potato intersects with several of these processes through polyphenols, fiber, potassium, and fermentation compatibility. This does not make sweet potato a cure, nor does it replace medical care. It simply shifts the vascular terrain in a favorable direction. Preventing stroke is not about one intervention. It is about stacking small physiological advantages over time. Diet provides one of the few tools available daily. For vascular goals, excessive sweet potato intake has diminishing returns. 2 medium sweet potatoes are generally sufficient. Individuals with digestive disorders or kidney conditions should be mindful of potassium and fiber tolerance, combining sweet potato with citrus peel. Vinegar and low-sodium preparation increases vascular relevance. Using the peel preserves antioxidant compounds. Fermentation improves absorption and metabolic handling. The broader principle is that vascular health benefits from foods that reduce oxidative pressure, improve sodium-potassium balance, and support microcirculation without adding metabolic load. Sweet potato is one of those foods. The brain depends on circulation more than any other organ. Tiny vessels determine cognitive fate as much as large arteries. Determine stroke risk. Supporting vessel health early may delay both stroke and vascular dementia. Sweet potato does not promise dramatic cures, but it offers a modest, scalable, affordable dietary tool that interacts with mechanisms central to brain vascular aging. In a world where many seek complex solutions, sometimes a simple food can quietly shift the trajectory of health.